The impact of the novel coronavirus outbreak has affected many over the past month, from those in education to small businesses to doctors and nurses on the front lines. Joining us on the broadcast to talk more about how COVID-19 is impacting medical professionals here in Jamestown is Dr. Betsy Kidder with the Chautauqua Center. Dr. Kidder, thank you so much for joining us today.
Thank you for having me.
Well, first off, since the outbreak began, how has practicing medicine changed for you and your staff?
It's really been a significant shift for us in the outpatient world. And I know for my colleagues around the county as well who practice outpatient medicine, we almost overnight had to figure out how to do medicine by video, medicine by telephone, get our patients queued up in order to be able to do that as well. Some of them don't always have the access to the digital technology that others do. And so that was a challenge for everyone, I think, in town trying to figure that out. And it's pretty remarkable. I think most practices, including ours, have done an outstanding job getting ourselves switched over to the digital world and figuring that out, and then pushing our insurance companies along the pathway as well in order to make sure that they're able to reimburse us for those types of services.
Now, in regard to COVID-19, it seems like federally what symptoms that we should be on the lookout for has evolved since the beginning of the outbreak. I ask, why is that? What symptoms should we watch out for now?
Yeah, it's really been a moving target from the beginning. I mean, we all are aware when this first hit that cough and fever were the real true symptoms to look out for and be worried about. But now it's just a matter of data. We've got more and more cases, we've got more and more information, and we've got certainly a bigger swath of symptoms that appear to be associated with this illness. Those include anything from pharyngitis, which is sore throat, myalgias, chills, loss of taste and smell. Sometimes we're even seeing GI symptoms like diarrhea be the presenting symptoms. So as the medical community, we've really had to shift our screening processes and how we evaluate some of our patients who call with symptoms with all of these new symptoms in mind. And of course, always taking into account these patients' other comorbidities, which means the other chronic diseases they suffer from, which may put them at higher risk.
Now, in regards to that diagnostic process, how does that work? If, say, someone in the community, one of your patients, was feeling sick, how would they now, under this new protocol, reach out to you and get an exam?
Yeah, we've done our best working with community partners to streamline this for the patients so that it's not such a difficult process. But right now, if you're having any sort of symptom, you should reach out to your primary care doctor. And they can easily write an order for a COVID-19 viral test, and they're able to fax that right over to our center. We have 2 testing centers at the Chautauqua Center, one in Jamestown, one in Dunkirk, and there's a 3rd center at UPMC who's also doing testing. And we call you the same day, get you in that afternoon for testing. And for those people without a primary care doctor, which there are many in our county, the Chautauqua Center is open doors to accept all new patients. We're happy to have you. And there is also a find a doc option that's been developed in our county for those people who are not sure how to find a new doctor, and they can call the Chautauqua Health Network. They have a number that's been advertised for find a doc.
Now, Dr. Kidder, this whole outbreak really has been so diverse in the fact that it's changed so much. In regards to treatment of COVID-19, I know there's a lot of information out there right now, but what do you recommend?
So from an outpatient perspective, we're not using any of the treatments you might have heard about in the news, such as remdesivir, which is the one that's gotten a lot of press lately. That's used in the inpatient setting for known cases in order to try and lessen the duration of symptoms. In the outpatient setting right now, we just treat our patients symptomatically. And that means if they're having some shortness of breath, we test them, obviously. They may need an inhaler. If they have COPD, we treat their COPD. We try and lessen their symptoms to keep them at home as long as possible. in order to prevent them having to go into the hospital. There are no magic bullets in terms of an easy medicine to give in the outpatient setting. And like any major outbreak, illness, virus, we saw this back when HIV came out, there's lots of interesting studies going on right now, and scientists are getting creative, and it's fun to watch and see these studies develop, but there's certainly no slam dunk at this point.
Now, I would imagine you probably know a lot more about this than I do, but in regards to coming to an end to COVID-19 medically, just like the flu, a vaccine is probably what is needed. And the process to get to the vaccine and then eventually distribute it to people here in the area is something that at the federal level, they don't even know what's happening now. Is that the goal eventually, to get people vaccinated to get through this?
That's the only way I see us getting back to any semblance of what our old normal was. You're correct. It is very scientifically complex. It's logistically complex. It's going to cost a fortune. We essentially have to vaccinate the world. This is not just a United States problem. I can't imagine any of this happening, before the next 18 to 24 months. So I think we need to get comfortable in our new normal. We have to get good at trying to live life in our new normal and do as much job work we can and practice good medicine in new ways, shapes, and forms. And it's a challenge to us across the board.
Now, here we've seen a good number of people locally recover from the virus, some good news there, but we've also seen a number of people who have passed away. What makes people more susceptible to maybe getting COVID-19 and then seeing some serious side effects?
Yeah, so susceptibility to getting COVID-19, what we know so far is obviously if you have any underlying medical conditions that decreases your immune system response, that is a big component of being susceptible. That can be any sort of lung disease, asthma, COPD, diabetes, obesity. We've seen that cancer can play in here, as that suppresses the immune system. Any sort of autoimmune disease or being on chronic immunosuppressants can also affect that. And I'm sorry, the second part of your question was?
In addition to seeing some of these, we've seen a few deaths related here locally. Those people who maybe are passing away, I know county officials have, it's strange how they have to give out that information, but in the beginning they've reported that some of the people who passed away died because of an underlying condition. If a perfectly healthy person, would they die from COVID, or does it depend?
It's a good question. We think there may be a viral load associated here because we are seeing, for example, otherwise healthy healthcare workers who end up getting coronavirus and dying from it. We suspect that they've gotten coronavirus because of the very heavy viral load that they're exposed to on a daily basis. We also know that coronavirus in some people will tend to migrate deeper down into the respiratory pathways and cause an inflammatory response that is very hard to reverse. And that is usually what ends in death. And we don't always know if that's going to be a healthy person or somebody who's got some underlying health disease.
Gotcha. And I want to reference real quick, a viewer, Pat, in our comments is asking, because we mentioned that new normal, and I've had this conversation really for the last month with everybody from elected officials to medical personnel like yourself. That new normal, is that the masks and the social distancing?
I think social distancing for sure is going to have to continue. Right now, we've done an excellent job in Chautauqua County keeping our numbers down, I think in large part due to that social distancing. Wearing masks, I think at least for the coming 6 months is going to probably be part of all of our everyday norms. It's hard to tell. Really, I think it's going to be county by county, state by state in terms of what our cases look like and what our surge looks like through the summer and fall in terms of when we can start to potentially peel back some of those measures. It's every day is changing. We can't really put a good predictor for the future out there just yet, I don't think, because we're just waiting to see how this virus and this pandemic progresses in each of our communities.
Now, in addition to COVID-19, I imagine that people still have to go to the doctor for other things. Have you seen patients become more hesitant to visit, or does that telemedicine that we talked about a little earlier, does that quell those fears?
They are absolutely more hesitant to visit, and very, very grateful for the opportunity to do online telehealth visits so that they don't have to come out and be exposed, especially in a medical facility, which a lot of people want to try to avoid at a time like this. That said, we here at the Chautauqua Center, and I know my colleagues around town, are all open for business. We are still seeing patients in the office here if there is something that needs to be seen physically, if we need to lay hands on that patient, if they need a vaccine that needs to be given. We are always open to see them in those situations, and we do so carefully. We put a mask on them, we put a mask on ourselves, we wear gloves, we keep ourselves safe. But yes, it's certainly a changing environment for medicine, and we're doing our best to accommodate our patients' concerns.
Yeah. And finally, and we thank you so much for joining us today, what is your general message to the community and to your patients as we continue down this path?
I talk to my patients all day about this, and I tell them, be patient. This is an unprecedented time, and it's not going away anytime soon. We need to be calm. We need to be smart about it. We need to take all the precautions that we're given and be patient, because this is our next 2 years we're looking at least right now.
All right, Dr. Betsy Kidder with the Chautauqua Center here in Jamestown joining us today. Dr. Kidder, we appreciate your insight, worth more than gold. Thank you for being here.
Thanks for having me.